it's one thing to take a policy or to show forth your commitment to equity, right? And you're placing it and embedding it into your policies and procedures, your SOPs or whatever. So you're showing your commitment. But what's more important to me is that you are taking actionable steps toward that, right? You're showing your commitment in that work that you're doing. So basically, every touch point that you have with your members / patients should reflect your commitment to equity. And that could be from your sales broker, your customer service representatives, your clinical personnel that goes into the home. Whomever touches this patient should feel seen, feel heard, and feel like this is a carved out treatment plan for them and them only.
Welcome to Unpacked Culture Chronicles. I'm Danielle Marshall, an equity strategist and executive coach, and I'm thrilled to have you here. This podcast is all about exploring cultural differences, similarities, and the ways that we can begin to bridge across them. Together, we're going to dive into meaningful conversations with guests from all walks of life. We'll share stories, insights, and practical strategies for navigating the complexity of culture in our workplaces, communities, and personal lives. Jay, welcome to the call today.
Thank you. I'm so happy to be here with you.
I'm so glad to be able to sit down with you. I'd love for you maybe just to introduce yourself a little bit in your own words. Tell us about your background and the work that you do in health equity.
Sure. So my background is working with major health plans and where I have served as a leader in healthcare quality. And so that really is the intersection between quality care improvements and Medicare STARS, which is the quality program. And so throughout my career, I have had the pleasure of creating strategies for access to care from ideation to execution, where I'm really just working on looking at the data to make informed decisions and utilizing that data to ensure that we're not just creating benefits and strategies, but they are accessible to our members. And so I have transitioned some of that core work that I've been doing into my consultancy, which is a health equity consultancy. Health equity is not a bad word, and I will not stop using it. But
Absolutely.
in the crux of what I do, it is really to work with other healthcare professionals, whether it's from a corporate standpoint or from a clinical standpoint, on how to be more thoughtful and be more conscious around who you're caring for and not just using a status quo template for every single person. And so, yeah, I'm happy. I'm grateful for the opportunity to have learned what I've learned throughout my career, to apply it to what I'm doing right now, and hopefully to do something else later on.
Yeah, thanks so much for that. And I'm loving that too, because I've been having a lot of conversations with people recently about this build it. If you build it, they will come sort of model. And we know that that's not true on so many levels. Just because we build something, if we do not engage the communities that we serve, if we're not thinking about their individual needs, it's really just not going to work. It's a Band-Aid fix.
And again.
So, now I know that you've worked at sort of the intersection of policy and equity for over a decade. I'm really curious what drew you to infuse equity into your policy work and maybe how that has made your approach more strategic.
Oh, that's a good question. So the work that I have been doing along these years really has been guided from what I call regulatory bodies like CMS, which is the Centers of Medicare and Medicaid Services, as well as NCQA. And so they kind of give us like the blueprints, and we have to execute in our own way. But in the days of old, I say the days of old, but remember, this is over a decade.
Yeah.
In the days of old, there was really no language around like disparities, health disparities, cultural competence, or equitable practices. It wasn't a thing. And so I think for me, my experiences what kind of drove my experiences on now shifting a little bit was I had the opportunity here in Texas to join our executive team members and leaders to do what we called a tour of Texas, where we identified, members who were not as engaged and maybe not so compliant as well. And so we traveled to them. Texas is big. So we had an opportunity to, secure a conference room, in a hotel and provide them with food. And it was at those meetings where I was able to hear real issues and real life barriers to healthcare. And that is what I brought back home to me and started to recalibrate a little bit. And I was able to take that experience throughout the rest of my career, and so now you're hearing language in the regulatory bodies, the guidelines around, disparities and cultural competencies and, more of SDOH, which is social determinants of health. So I'm happy to have been a little bit ahead of the work, but I'm so happy that we're here where the conversation is now broadened.
Yeah, that I think that's wonderful. And I know that a lot of people are still struggling with this idea of like how do we connect to the community and quite frankly, what's the purpose of it? And I'm wondering from that experience that you had, were there any like stories or moments that really stuck out to you that like shaped the way that you think about your work today?
Yes, thank you. So there was a lot of this is Medicare, so we are dealing with the aging or the elderly community. And a lot of the commentary we would get is, I live alone, I don't have anyone, or, transportation issues. And so at the time, well, actually at the time, the next role I had an opportunity to work with our dual SNP members, which is dual special needs. These are individuals who have both Medicare and Medicaid. And so now I'm taking those stories with me and I'm like, okay, let's implement some transportation, vouchers so people can actually get to the services that we're providing get there. But yeah, there's a lot of situations where some of our patients or members are not even, they don't have any support, which I heard that a lot. Believe it or not, maybe they have lost their spouse, or maybe their kids live afar. So there's always different scenarios, and I always say we're not here to solve for every scenario, but those common themes that we keep on hearing, we need to be able to solve for.
Yeah, absolutely. And that sort of takes me to the next question that I wanted to ask you because health equity often gets treated as an isolated issue. But even in the story that you just gave, this is something that will ultimately impact all of us, right, at some level, because we are all, God willing, going to get older and be that same population you're talking about. We may have family members, whether it is your parents or grandparents, someone in your family in your life is going to get older. And so what would you say to people about why health equity matters, regardless of someone's background or their social economic status?
Ooh, okay. So here's the deal. I'm gonna go into, the two types of people we have in the world. So you have your haves and you have your have-nots, right? Your have-nots are going to be those individuals who are either underinsured or uninsured. And then you have those who have insurance. For the most part, those individuals who are underinsured or underinsured are likely to not go to the PCP for routine checkups, labs done, take medication. But what they will do, what you can count on, is if they feel sick, they will go to the ER. And 9 times out of 10, the ER, the hospital will not turn them away. So somebody has to absorb that cost. And so you think about the haves, now they're going to start having their insurance premiums increasing and you're wondering why. It's because your neighbor next door had to go to the ER multiple times throughout the year and you have to absorb that cost. And so I think if we start thinking of it like that, you are your neighbor's keeper in that aspect. I live in Texas. Texas is well known for, having a lot of natural disasters. And thank God, because I'm in the boonies, I'm out in the suburbs outside of the major city. I have never filed a claim. I don't have any flooding, roof damage, knock on wood here. But
Absolutely.
but guess what? When you think about our neighboring city, which is like 45 miles away, because they have a whole host of claims, my insurance has now gone up. So you think about that kind of. So I think when we put it into that context, we all have to pay for um, for the cost of others. I think that's just kind of how it is.
Okay. And I think that is food for thought because oftentimes, especially given sort of the landscape of our country today, like people are very much thinking about themselves, their families, but they're not thinking about how others who literally are in their communities or to your point, 45 minutes down the road, that they're going to have some impact on us as well.
Yes,
Um,
so
so
true.
something else I wanted to talk to you about was just provider experiences, right? And in terms of the provider experience, it can trickle down to patient outcomes. What do we miss when we're not being culturally responsive in healthcare settings?
Oh, so if cultural responsiveness is absent, in a nutshell, I'm going to say you're not taking care of the whole person. There is no way you have a lens that is very narrow, and you're treating everyone with this narrow lens, and you have to be curious. And I always say that's just like the gateway to transitioning into something more is to be start by being curious. And when you're thinking about your patients and how they come from different backgrounds and ethnicities, you have to be curious enough and be willing to learn and be open enough to know that your way of thinking, your experiences, your upbringing is not the only way. So I just would say, in a nutshell, that your patient's outcomes are going to be impacted if you're not culturally responsive. I can give you a really good example. This is just a fictitious scenario. Let's just say you have James. So James is a middle-aged Black man who is a father of three, in a household of five, and maybe he's the breadwinner. Perhaps he has a low income job. He's likely to prioritize putting food in his fridge opposed to going to his PCP doctor on a routine basis. Let's just say he has diabetes and he should be going regularly. So now that's a factor. It's very easy for that provider to state this is a lazy patient. This patient doesn't care about his own health. This patient is non-compliant. But if you are culturally responsive, you're going to say, hmm, maybe I should contact Mr. James and see, does Mr. James need diabetic education? Does he need me to provide him with telehealth services? Does he need, me to send a clinical professional to his home to do his blood sugar? I mean, all those things you can think about if you are culturally responsive. But if you're not, you're going to assume that he's lazy and you're not going to care for him. You're going to just leave him to the wayside and he's going to be just a forgotten patient.
Yeah. I love that example because not only do I see that playing out in health equity, but I also see it in so many other dimensions of our world. And I'm going to share a story in just a moment too. But you use the word culturally responsive, and I definitely think that's a piece of this. But to some level, like we also have to think about our cultural awareness. Do we even take the time to learn about people in order to be responsive?
Yes.
So as you were sharing that story, I was thinking about another client I worked with, and it was a legal team, and the team was frustrated with some of the people that were coming into the local clinics they were doing. There were people that they, I guess, sat down and they had counseled in terms of what were the next steps for them, and they had taken
Mm,
care of some of the business. And then there was another woman there who didn't do anything, and she said, "I'm going to go home and I want to think about this for a little bit, and I'll come back and talk to you." And so,
mm,
to your point around like laziness, like how some people were thinking about this is like, well, we had this one woman who came in and she did everything on the spot, signed her paperwork, and the other person's like, she doesn't want to do it. There's
yeah.
something, I don't know why she doesn't want her case to move forward. And I asked them, I said, tell me a little bit about who these people were. And in the case of the person who signed off on it, it was a white woman. And I said, well, okay, what
Hmm.
do you understand about white culture in this country, right? Like they're eventually we got to the point, like they're very individualistic and can often make decisions on their own. They don't need to consult with anyone else. And in
Yeah.
the case of the person who did wanted to take this stuff home, she was a Latina woman. And I said, what do you know
Mm,
about, Latina culture? And they were like, well, we don't know a whole lot. And I said, well, do you understand what it means to be part of a collectivist sort of mindset? I said, she probably went home to talk to her family, maybe the priest, to make sure she's making the best decision. And it's not
yeah.
that they're lazy or not bought in, but this is really a matter of like, we're doing what fits in our cultural norms.
Just that simple.
Yeah.
Just
And
that
so I
simple.
think in order to be responsive to your point, it's like we have to be aware of what might come up. And I'm not saying that everybody's going to function exactly the same because we're not a
That's
monolith.
right.
However, but we should be aware not necessarily of the stereotypes, but the patterns that emerge in culture.
Woo, you can preach, girl. That is good. Yes.
So, as you were given the story of James, our fictitious person, something else that I've been thinking a lot about is Black maternal health, right? And we
Mm,
know that there have been some real challenges in that area. And a question that I want to ask you is what do we need to really understand about how cultural insensitivity or systemic bias affects people's outcomes in this area?
man, that is, I'm starting to hear more and more about Black maternal health rates, things like that. But here's the thing. I feel like we're in an echo chamber and we're talking to ourselves. Like I'm seeing it. I wish we can broaden our audience to us because this is something that is a major thing. A fact is that black pregnant women are 3 times more likely to die due to pregnancy-related causes compared to the white women, their counterparts. And it also increases the morbidity rates for their babies. And
Right.
so this is a fact, And so with this, when I think about this topic, I always think about the trope that that trope that we hear all the time. I'm sure you've heard it, strong black woman is so strong. It's, when you hear it, it sounds, on the surface, it sounds good. It sounds empowering. I mean, who would not want to hear that? But when that context kind of get trickles down to other places, other spaces, and with other faces, they hear that and they assume that we are strong, we can take care of it. Our tolerance rate is higher than the average person, and that's just not the truth. And I think what it all boils down to, believe our women. If a woman comes in, a pregnant woman comes in and she's saying she has, she's having bleeding or she has pain, it is not up to you to just turn her away, because now you're infusing your biases into that conversation
Mm-hmm.
and you're not doing a proper evaluation. And so, I really wish that, like I said before, that we can start to have more instances. I mean, we're starting to see where there are real life consequences that happen to women, whether they are, again, pass away or their child does. Maybe not the same day, but maybe days later. I mean, all those things. And I will just say this: I will say maybe I don't have that story, and I'm grateful that I don't have that story. My son is 15 years old. I never shared this story, but I literally went to the ER when I was pregnant with him at least 3 to 4 times. The very first time was because I was hemorrhaging and I wasn't even showing yet, so I was so nervous. But as the pregnancy went on, my doctor told me, "Hey, you should feel your baby every single day." And so and I know that if I eat grapefruit, which is my favorite thing to eat, that baby is moving around, you know. And so I could think of one day I ate my grapefruit and I'm talking and I forgot. And I was like, wait a minute, I haven't heard this, felt this baby move. And I went every single time that I've gone to the ER. I've always been believed. I've always been heard. I think that's a privilege because I actually worked for the health system, not at that hospital, but the health system. I don't know if there was something that says ding, 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 she works here, because they always knew that I worked there. And so not my point of the story is that I don't have that story, but just because I don't have that story, that doesn't mean I can't understand the plight of those who don't have that story. And it is very, very heartbreaking to see that, you can, because I work there, that should not be the only reason why you see me. But I went 4 times and I didn't get, shunned away. I got ultrasounds every single time. So it
Got
can happen, is my point. You can believe a woman. You can do the proper protocols, lab work, ultrasounds. You can do it. You did it for me. So,
I love that you bring that up because, again, it speaks to the lived experience does not have to be our lived experience in order for it to still be true.
that's
But
right.
I think the other thing that I'm hearing in there is like you clearly had a privilege in that moment. You were educated about what healthcare should be and what you should be provided,
Hmm.
and you were a part of that system. And so it's like you have more information than the average person. Like I certainly know when I had my daughter, and I was back and forth to the hospital plenty of times. I did not have that. Like I am an educated person, but that's not my world specifically. So I
Yeah.
didn't know what to ask for. And, more and more, I've been telling people a little bit about patient advocates when they are in healthcare settings to make sure that you have someone who is actively advocating for your
Yes.
needs. And I just wonder if you even have any thoughts about that.
Yes, yeah. I mean, having an advocate. I will say also, I had a doula as well, so I would say that was my advocate. And so whereas though this was all new to me. I mean, I did go to Lamar's class and all those kind of things, but having someone who this is their wheelhouse, they can tell me what I remember that day I gave birth, and she was asking questions that I never even thought about. So yes, having an advocate there with you is so important. I mean, maybe it's not a doula or whatever, but you have even a parent, someone who's been through this, who can advocate for you in those moments.
Yeah. And so, yeah, absolutely. Particularly because most of us are not going to come equipped with that knowledge. And so, just having that person who can speak on your behalf and not necessarily overspeak you, because I don't want folks over talking us in these moments. Like, I
Yeah.
want my voice to come through, but they know the right language to use in the medical facilities to get things to advance for you. But what you're sharing also makes me think about the types of providers that we have access to. And in particular, I would love for you to talk a little bit more about like why it's essential to have healthcare providers who can genuinely like relate to the communities that they're serving, like that they may come from those communities, they have a deeper level of cultural competence, and perhaps even like what's at risk if we don't have those voices as part of this conversation.
Ooh, this is like one of my favorite topics, to be honest with you, because it is so easy to just take your practice, your doctor's practice, and just pop it into a neighborhood, right? Maybe you've done your research, location is good. Maybe you're close to you have good access to other doctors or whatever. But what's probably more important in my mind's eye is to understand the makeup of that community that you're serving. If you are going to be in a community, and let's just say you have a high population of a marginalized group, know who they are. What if you have someone who, or I should say, population who prefers to not speak, their first language is not English. They have limited English proficiency. Know who they are. Because the other piece is, I'm going to say two things. The other piece is you want to make sure that your workforce represents who you're serving. I think that is probably the biggest key. I mean, we all want to see ourselves when we go to the doctors, right? I mean, especially our older patients, they want to see themselves in that way. That speaks to language barriers. So now you have people on your team who can maybe translate for your patient. But the other piece that I want to talk about is my favorite phrase is to say tap in. Get tapped in. There are nonprofit organizations in your community. There are advocates. There are loud voices. There are, local politicians. Get involved so that you can understand really what does care look like for this community. It's not going to be the same as your last community, but what does care look like for this community? And you can get creative and create community advisory boards with individuals from the community, and making sure that the voice of the voiceless is being heard in those meetings. And as someone with some influence as a doctor or a doctor's office, you could also help with advocating for them for policy changes. So there's just so much. I think that it's so important for you to understand who you're serving.
Yeah, I love that because we seem to be really stuck on this idea of like we can do everything ourselves. And I just fundamentally do not agree with that. We cannot
Mhm.
lean only on our own understanding of the world. And so the thing is, and I work a lot with nonprofits, and the benefit of having partner agencies is you have your niche, right? The thing that you do really well, but these partners also have the thing that they do. And oftentimes they're deeply embedded in the communities, which means not only can they help connect you to better understanding about them, sometimes like the medical providers need to get information from the communities about what's important to them. And I'm like, this is a fantastic way to do it rather than coming in as a quote unquote outsider and trying to be extractive with
That's right.
information. This way we're partnering to co-create together.
That's right.
Yeah. So, and again, on that front, right, like as we're thinking about what it might mean to reach out to partners or patients, this idea of communication comes up for me. And so it's not just with the patients, it's also with the providers. And I'm wondering like what you've seen on this landscape with respect to like differences in communication styles and how that impacts like the team dynamics you see and ultimately the patient care.
Ooh, you know, um, with this question, the first thing that comes to my mind is the word bias. I know I mentioned it earlier before, but your biases obviously can skew your communication, right?
Yeah.
But again, with my storytelling, you have a PCP and you have a specialist, right? So this PCP is going to now refer its patients to this specialist. So now, because they know each other, they are connected, maybe by a network. This specialist has access to with PCP's notes on that patient. So there is a thing called availability heuristic. That's a type of a bias where you are literally taking the information that is available to you and you're forming your opinion, your treatment plan only on that. You're not doing any excess research. When that patient comes in your office, you're not asking critical questions or doing assessment. Like that is an example of a breakdown of communication for me. Another thing is confirmation bias. Oh, that's a good one. So
Yeah.
confirmation bias is you've already, or that PCP has already kind of informed having a formed opinion about this patient. And so now they're communicating that to the specialist. And the specialist is now looking up information that supports those symptoms, that evidence. They're not doing anything. It's just, you know, the
Yeah.
doctor told me this is what it was. I believe this is what it is. I'm going to just look up information on just that. And the last one, and throughout communication, is authority bias. I think about, having an authoritative figure. Let's just say a senior doctor. The PCP is a senior doctor. And so you think that everything this doctor says is gold. And he tells you, no, it's this. Got to be this. This is the diagnosis. This is the symptoms. And because you see this doctor as a senior doctor, that specialist is going to go off of the words of that PCP. And so I know that just kind of rambled through different types of biases, but I think when you I want to bring that up because we all have biases. Our upbringing, the church we went to, our school, who raised us, who sits
Absolutely.
at the table with us during Thanksgiving. All those things get dumped into us and shape who we are. But I think what's important is we identify our biases and we work to eradicate them. That's communication comes from that. So especially in the healthcare
Yeah.
professional.
I'm like appreciating what you said because this is a conversation I have all the time. Like we all have inherent biases. And for the people that want to say like, I'm not biased, like it just means that you're unaware of said bias.
Yeah.
Every human
Yes.
carries biases. And so for me, it is definitely about being able to raise your level of awareness so that you can start. I know that we can't completely erase bias, but like at least mitigate it, ask yourself better questions in the moment so that maybe you're not leaning too heavily on that particular bias that you carry. But something that I'm wondering just after listening to you talk about that is, are there actionable steps that we can take as patients to maybe disrupt some of these biases that are going on within the healthcare system? So if there is an authoritative sort of bias or it's an availability bias, what do we do as the patient when we come to the doctor to make sure that we are advocating for ourselves?
You know what? Speak up. I think a lot of patients, they look at the doctor as, for all intents and purposes, God. Like they are going to, especially, I mean, I know a lot of older members of my family. Whatever the doctor says, it's gold. And I think if you learn to speak up and advocate for yourself, if you hear something that doesn't sound right as far as your treatment plan, or if you are getting an excessive amount of prescriptions. Maybe you don't want to be on so many prescriptions. Explain that. I think we're all patients, so I say we. I feel like
Absolutely.
we as patients don't realize the power that we have. This is our body, and we have to advocate for our own selves. Sometimes, we have to speak up and say things like, I'm not going to be able to afford that. Is there an alternative? Or that medication that I used before last year, I got sick from it. Those kinds of things. And so I think that we don't realize the power we have. No, we're not doctors, but we are the doctor of our bodies, so we can definitely advocate for ourselves. And I think just speaking up is the key.
Yeah, I love that you gave those practical examples because I know for me, even myself, I've had to tell my doctor, like, I do not want to take that pill again because I don't like how I feel when I'm taking it, right? My
That's right.
stomach is upset or I have a headache or just being able to verbalize that. And oftentimes they have found something that works a lot better
Alternative.
for me, right?
That's
But I
right.
would not have gotten that had I not opened my mouth to say something. So I appreciate that.
Mm-hmm.
This episode of Unpacked Culture Chronicles is brought to you by Culture Principles, an executive coaching and consulting practice that helps leaders and organizations turn inclusion from an idea into everyday practice. If you've been listening and thinking, I want to grow my cultural awareness, but I'm not sure where to begin, you're certainly not alone. And that's exactly why we created the Cultural Competency Executive Coaching Program, a space to deepen self-awareness, lead with cultural humility, and build stronger connections across difference. You can learn more at culture-principles.com/coaching. I'd love to support you. But Jay, one of the things I guess that's really interesting is as we talk about like people advocating for themselves, and you mentioned even a moment ago, like some folks that are older really believing everything that the doctor may say. I'm also thinking about what happens on the reverse side, because there are many communities, particularly communities of color, where there has been some historical thing that has happened where people do not feel safe in the presence of doctors. And what would you say to them?
That is such a good point. The first thing that comes to my mind is thinking about clinical trials. And so, yes, we know because of history tells us so, that our people, Black individuals, Black Americans, African Americans, they don't tend to gravitate to clinical trials, even in the midst of their ailment. They don't want to do it. And so and I understand it. Listen, I understand. You think about Tuskegee, think about syphilis, think about all those things, and you can say, okay, I get it. But today, we have advanced technology, and so much so in healthcare that it's safer. And I would say, for those who have those apprehensions or those fears, think about if you were hospitalized for a condition and your only way of getting help would be a clinical trial. That trial now is not made up your markers, because no one in your community wanted to be a part of the trial. And so now they are matching you with your counterpart, maybe a white female or a white male, because you did not participate. And so I want to just share that. It's a small little nugget, but thinking about being more receptive. Ask your questions, don't go in blindly, ask all your questions. If you're signing waivers, make sure you're reading what you're signing to make sure
Absolutely.
that this is not another, Henrietta Lacks situation that people are utilizing your DNA for something else, but making sure that you are informed, you feel comfortable, you feel safe, and think about that next person who looks just like you, who may need a clinical trial, and now they have something to bump up against, something to
Yeah.
compare, opposed to comparing with, someone else.
Yeah, thank you so much for sharing that, because this really is a two-sided coin that we're dealing with, because my work is really about trying to make sure that people are infusing equity into their work on a daily basis. So for a healthcare system, that might mean increasing the number of people of color or people from different gender identities, et cetera, into your studies. But
Yes.
also, they can only do that when we say yes.
Mm.
Right. We have to also own our responsibility in this moment to step up and say, like, yes, I will participate. I know historically some things have happened that have not been the best in our community, but because I care about myself and future generations, I do
Yes.
want to participate in this so that we can have the best access to medical information that we possibly can. So thank you so much for that.
You're welcome. I'm glad that you get it. That's the most important part. You get it.
So I kind of want to shift gears a little bit, because I wanted to know more about, like, I know you started some time ago with the work that you're doing in health equity, and there are always shifts that are occurring in the work that we do. And so I'm wondering here, like, maybe what types of shifts you've seen, like embedding health equity into the system, CRMs, or what's been the impact of some of the efforts that are happening right now.
you know, um, well, I guess I will take that from a more of a personal
Sure.
experience. I think when you are, so it's one thing to take a policy or to show forth your commitment to equity, right? And you're placing it and embedding it into your policies and procedures, your SOPs or whatever. So you're showing your commitment. But what's more important to me is that you are taking actionable steps toward that, right? You're showing your commitment in that work that you're doing. And something that I had an opportunity to work with a small organization who was looking to get accredited for health equity. And so this is what I'm telling them. And so basically, every touch point that you have with your members slash patients should reflect your commitment to equity. And that could be from your sales broker, your customer service representatives, your clinical personnel that goes into the home. Whomever touches this patient needs to be able to. This patient should feel seen, feel heard, and feel like they are getting. This is a carved out treatment plan for them and them only. And I
Mhm.
think once we start to do, implementing these changes and not just word service or having it on black and white, but making sure that our workflows is embedded into, has those practices embedded into it, and then it becomes a cultural experience within the organization. It's not, and it moves from this is a nice to have to this is a must have.
Yeah, I don't even know what to say about that. Like, we keep treating equity as if it is a nice to have, and yet it is literally, in this case, it may be the difference between life and death for people. Right? This is not
Yes,
an additive thing. This is about prevention. It is about proper care, about dignity for
I am
individuals.
so glad you said that, because there are really real life instances where, I'll just share this really quickly. So yesterday I had the opportunity to I watched like independent media, and I actually saw individuals. They were at the Capitol, not getting in political. I'm just gonna tell you what I saw. They were at the Capitol. They were basically protesting this big beautiful bill because one of the core pieces of that bill is to remove Medicaid. And listen to the correspondents ask individuals there, why are you here? Why is it so important to you? And hearing those stories, it's like we have to make sure that we are in, and we are finding a way. And this is a systematic thing, and we have to find ways to embed equity into every part of healthcare. So I just wanted to share that real quick.
No, I mean it has real time consequences, is what I'm hearing. Also, I mean, this is
Hmm.
not a 20 years ago this thing happened. Now we are dealing with it present day. And I guess I'm also wondering, like, so obviously there are bills that are approaching that may be redacting some of the services and care that we have, and the funding to go with it. But I'm wondering if there are other maybe barriers or challenges that you've seen, even outside of like any political sort of landscape. What is stopping people from really advancing health equity in their healthcare systems?
I think a lot of times it's resources. I think it's resources, it's funding, it's just getting that yes, from that executive leadership. I think for me personally, so as I mentioned to you before, I, you know, keep those experiences where I had those member meetings with those members, and they stay with me. And so even now, and one of my last roles at the health plan, have a great idea on strategizing around access to care.
Mm,
But one of the issues where, and I can go again from ideation to execution, but I get stopped right here because whether it's recording, whether it's resources, whether it's funding, it could be a whole host of things that could stop you from ensuring that you are moving forward with your plans. And so I think that's probably one of the biggest barriers for me. And also influencing others and explaining to them why this is important, especially those who may have been in, they 30 years in, 25 years in the business, and they want to stick to what's worked years
yeah.
ago. They're not really receptive to change.
Yeah. And so it sounds like we have some work to do there, and what I hear that as also is it's advocacy. And I think a lot
Yes,
of times people think about advocacy as, it's a Washington D.C. type of thing. And I'm like, no, advocacy starts anytime we open our mouth to educate people on a particular issue. Like, how are we advocating for the needs that we have as individuals, to
that's
your
right.
point earlier, and also like how we're advocating to make sure that the systems actually are working for everyone, because we want to make sure that we're protecting people's literal lives in this case.
That's right. That's right.
So let me ask you, Jay, is there anything that you want to share with listeners as a takeaway, or even just tell us a little bit about like what's coming up in your business?
Oh, well, thank you. So a core offering that I offer, my business is called Culturally Elevated. I should have said that before. So Culturally Elevated Consulting is the business name. And one of my core offerings is to offer online courses. Right now, I'm in the transition phase right now from one platform to the next. And so right now we are at a pause, but they're coming soon. These are interactive courses where it's a talking head, and I am the talking head. And I am basically going through topics like social determinants of health or biases, even some other quality pieces as well. And so these are professional grade courses that's really to improve your work that you're doing today. So yeah, I'm looking forward to bringing those back in a new platform. So soon to come. I also hosted a series. It's called Impact Series. And I loved it, and I want to bring it back. So I would just say keep in contact with me on LinkedIn. I am Jay Palmer on LinkedIn. I always post whatever I'm doing, and so you will definitely stay tapped in there. But yeah, that's it.
And one other question, just as a follow up on that, who are these courses best suited for?
They are best suited for those who are just like me, who come from healthcare organizations, who are decision makers, those who are their sole purpose is really to drive quality improvement strategies. And also from a clinical setting, it could be a provider, it could be, clinical staff. So anyone who touch patients.
Okay.
In the health plan field, we say members. but it's the same. Members for us, patients for them. So anyone who interact with patients, members, these courses are good for you. And I'm looking hopefully to get them accredited so that they can be used for CEU. So coming soon.
Okay, I love that, and we'll make sure we put that link in the bio as soon as the course is up and running. Jay, it has been a pleasure to talk to you. I have all these ideas. I'm sitting here mentally thinking about what questions I'm gonna ask my doctor next time I go visit her as well.
Yes, do that.
I
Yes,
tend to ask questions anyway, but I'm like, well, maybe I missed a few. And so I'm gonna go back in with that spirit on
please
my
do.
heart. But it has been an absolute pleasure to just sit down and talk to you today. Thank you.
Thank you so much. This was great. You have a great thing here, and I appreciate the opportunity to join you. This was fun.
Thank you. All right, take care.
Bye bye.
If you enjoyed this episode, be sure to subscribe, leave a review, and share it with your network. It makes a big difference in helping us grow this community. And if you're looking for coaching or resources to take your cultural awareness to the next level, visit us at culture-principles.com/coaching. And remember, where curiosity leads, connection follows. Be well.